Hi, I'm Alex, and this is Missy, and we're going to go over frequently asked questions post bariatric surgery. Okay, the first question, we're just going to start with them. They're not in any particular order. Is how long after my bariatric surgery should I wait to get pregnant?
Normally, we ask that you wait 18 months because at this point your weight is fairly stable and any complications that could arise are over. So we like for you to wait 18 months.
Okay, the next question that we frequently get is, after my bariatric surgery, what medications can I and can I not take? More specifically, what over-the-counter medications am I allowed to take and not take?
All over-the-counter medications such as Tylenol, Tylenol Cold, Mucinex are perfectly fine after surgery. There is a misconception about I'm not able to take this because my pouch, or I've had bariatrics so I'm not able to take this. All that is just a misconception. You can take most or all any over-the-counter meds. Again, with the NSAIDs, that is another misconception. We just don't want you doing high doses. And NSAIDs, I mean ibuprofen, Motrin, Aleve, non-anti-inflammatory.
Another commonly asked question is, how long do I need to take my PPI or my acid reducer after my bariatric surgery?
We ask that you take this for 6 weeks, so if you're having any reflux, this will help prevent that. Normally, after bariatric surgery, if you allow your stomach to get empty, it creates that acid and you get the reflux, heartburn. And so we ask that you take it for 6 weeks. We'll wean you off at that 6-week mark. If you're having symptoms, we'll keep you on it, and then you'll come back and visit with your provider to see if there's any other options.
Okay, another question. Do I need to take the PPI that you gave me, or can I take one that I was already taking?
You may take the one that you are currently taking. We will not give you an extra one unless you run out and you need it.
I know that I have been given a blood thinner to take after surgery. When do I start that? How long do I need to take it?
We have you start that 3 days after surgery, and you'll take it for 30 days.
Do I need to consult with my cardiologist if I'm already on a blood thinner?
Yes, you will need to get directions from your prescribing doctor. They will tell us when you stop before surgery and when to resume after surgery.
Okay. When do I need to get labs checked after my bariatric surgery?
Your first time that we will check labs is at 6 months. You don't need to ask for them ahead of time. At your 6-month visit, you will get that lab order and you can go and have them drawn at any location that works for you.
Okay. After my surgery, if I'm having some hair loss, what can I take to help?
Biotin, you can get it at our store or you can pick it up at any pharmacy, Walmart, CVS.
After my surgery, when do I need to start walking? How much do I need to be walking? Is too much walking a bad thing?
We want you to get up and walking as soon after as possible. So you wake up out of surgery, if you feel like you need to walk, get up and walk. The more you walk, the better. You're gonna have that blood circulating, so that prevents blood clots. And right after surgery for about 72 hours, that's going to help get that gas out. And the only way to get it out is to walk.
Okay, when do I need to start the vitamins after surgery?
We would like for you to start them once you get home and you start a schedule. So do I need to take them the day I go home from the hospital? No, because you're probably going to go home about noon. And so we tell you just start the next morning and you're on a schedule. You take them in the morning, you take them at night, or however you are prescribed to take them. It's individually prescribed most of the time, so your dietitian and doctor will let you know.
What if I feel like I can't take them right after surgery? Can I wait a couple of days?
Absolutely. If you're not able to tolerate them, you can wait even up to 2 weeks. At that 2-week mark, you should be able to take those vitamins.
Okay. How much pain do you think I will be in after surgery?
It depends on the individual. Everybody experiences pain differently. It should be minimal. However, if you are one that you have a little bit extra pain, that's perfectly normal. We give you some pain medication. We tell you can use a heating pad, walking. There's lots of things that you can do to help you with your pain control.
So I want to start exercising after surgery. I've never exercised before. So when can I start?
Once you feel like it, we want you to start walking as soon as you can. So that is a form of exercise. Once you get to a certain point, that's not going to be exercise. You need to get your heart rate up for exercise. So for the first 2 to 3 weeks, walking is going to be great. And we want you to do that as soon as you feel like it. After 3 weeks, your restriction's up. You have a 10-pound restriction for 3 weeks. So no lifting, no incline on the treadmill, but walking. And even the elliptical could be a little strenuous because you are pushing your own body weight. So that could be more than 10 pounds.
So at 3 weeks, I can start doing some ab exercises?
Yes. You are going to listen to your body because only you know what hurts and where you are on your healing process. As far as your staple line, it should be completely healed and the restriction of the 10 pounds is not in place, but you also know what you can handle.
When can I go back to work?
We tell patients that you can go back anywhere from a week or you can take up to 3 weeks because of that 10-pound restriction. It'll all depend on your job and how you're feeling. Since you do come and see us at a 2-week mark, you can wait until that mark, check with your provider, and see if you're okay to go back to work.
I have some FMLA paperwork that I need filled out. Who does that for me?
Alex and I do that for you.
So do I need to bring it by the office or have it faxed or either email?
Email, fax, bring it by. There is a $20 fee for us to complete that paperwork, and we will complete that approximately 2 days post-surgery because we have to have some information from the hospital.
And it will help if you attach the dates that you want for the FMLA paperwork, the first day you're going to be out, and the day you want to go back. And just remember that you can go back after a week or however many days you want, but you will be on the restrictions, so just keep that in mind. I have a question about alcohol. My surgery is on Monday, and my birthday is the following Friday.
We actually want you to never have alcohol again because it is just not appropriate. However, in moderation after a year, we'll be okay.
Do you think the alcohol is going to affect me differently after my surgery?
It will most definitely affect you differently because the consumption rate will go down drastically. 1 or 2 drinks and you'll be good for it.
A very common question asked is about gas, if you're going to have gas. Am I going to have gas? Are there different types of gas? And what do I need to take for the gas?
You will have gas. There are different types. You have cavity gas about 72 hours after surgery, and that's just them inflating you to get to the organs to do the procedure. The only way to get rid of that is to walk. The next gas is intestinal gas. Now, we give you Milacon, Gas-X, Simethicone, any of those. That will be for that intestinal gas. That's when you're gulping air, when you're taking a drink, eating. Unknown reason how you get it, but the Milacon, Simethicone, Gas-X will help with that intestinal gas.
Okay. What about constipation? I've heard that I'm going to have constipation after surgery. But then my neighbor also told me that I could have diarrhea.
So you can have either or both. Constipation is very common because you're increasing your protein intake. You're also limited on your fluids just because of the smaller stomach. However, we want you to do the fluids number 1, protein number 2. So that is sometimes confusing for patients. Remember, fluid, fluid, fluid. Also with constipation, if you have not had a bowel movement by your 2nd day, 3rd day after surgery, normally about the time you start your blood thinner, we want you to add a laxative such as Miralax or milk of magnesia to your regimen. So you're taking a Colace twice daily, which is a stool softener. On top of that, you're going to add the laxative, which is the Miralax or the milk of magnesia.
So if I'm having loose stools, do I continue taking the Colace, the stool softener?
No. That is on the diarrhea. We do not want you to continue the Colace. We don't want you to continue milk of magnesia or Miralax. We just want you to go back to what was happening before the diarrhea started.
Okay. What if I'm feeling nauseous or I start throwing up?
So there's
can I take?
different reasons that you could be nauseous. It could be because you're eating too fast or too much. So watch that, see if that is the reason for it. We give you ondansetron or Zofran, which helps with nausea. If that takes care of the nausea, then pay attention and see what's causing my nausea. If you can't pinpoint it, of course, call us. We'll get you in. We'll take care of you. We'll figure it out.
What if I start to feel dehydrated a few days after surgery?
Of course, we're going to tell you to drink, drink, drink. Call us. We will get you in. You might have to get some fluids here. We also can arrange home health to come out and give you fluids for about 7 days.
Okay. So I've noticed since my surgery, I feel like every time I eat or drink cold water, sometimes I get a pain kind of in my chest or at the bottom of my esophagus. Is that normal? Is it going to go away?
It is normal. Sometimes we will tell you just to have room temperature water, warm water. Trying different temperatures can help that. If it continues, again, come in and we'll take care of you.